462,528 cumulative cases. The testing volume for today was 727 cases on a volume of 21,432 lab tests reported yesterday, announced today. We had over the weekend an additional 19 deaths reported on Saturday, 13 on Sunday, and 2 COVID-19 deaths reported today, bringing us to a new total of 6,202 Minnesotans who've lost their lives to COVID-19 since the start of the pandemic. We currently have 387 people in Minnesota hospitals being treated for COVID-19, and those 92 are in intensive care. There's a total now of over 24,300 patients in the hospital in total, and over 5,000 who have required intensive care. We continue to see encouraging trends in the rate of growth in our cases, declining week over week again. While testing is fairly stable, has rebounded a bit, and we would really like to see testing volumes come back up to where they were earlier in the fall, so that we're sure we are catching the cases that are out there. We're pleased that the 7-day rolling average test positivity rate remains just below 5% at 4.8%, but we will continue to watch those data very carefully. Just a really quick update on vaccine, and then Chris is going to go into more detail on the numbers in a moment. Nearly 560,000 total doses have been administered to Minnesotans as of our last report. That is a combination of first and second doses. So the total number of people who've been vaccinated is almost 442,000. And I think I will talk a little bit now about the news release that the governor's office sent out early this morning, announcing kind of the next steps forward in how our entire vaccine ecosystem is working together to serve Minnesotans. This morning's news release announced that more than 35,000 doses have been allocated across the state to help providers serve Minnesotans age 65 and over. So the goal here is to improve access closer to home, with more COVID-19 vaccines being available at clinics, hospitals, community vaccination sites, and other locations across the state this week. Now, I want to just reinforce that this is still a relatively small volume of vaccine to spread over our entire state, so any one site is not likely to have a large supply of vaccinations. We've said from the very beginning that most Minnesotans will end up getting vaccinated in the places that we are accustomed to getting most of our healthcare. Places like our clinics, our local hospitals, our community pharmacies. But we know that not everyone has those established relationships. And that's why we spent time really planning and building a strong, reliable, and stable network of several different ways that Minnesotans will ultimately access the vaccine as that supply continues to build in the coming weeks and months. As we are working through the initial phase of vaccinating healthcare personnel and those Minnesotans residing in nursing homes and assisted living, with an increased vaccine supply freed up from getting through those populations, with some growth in what we're getting from the federal government, and after a successful 2-week pilot to test the concept of community vaccination clinics, today we're building on what is really a strength of Minnesota's vaccine infrastructure and moving forward with our planned approach to use really all available distribution channels to get vaccine out to people. This approach, our proven kind of backbone vaccine distribution system that we rely on every year and continually for routine vaccinations, supplemented with permanent community vaccination clinics, will enable us to build up the ability to handle even more capacity in the coming months as vaccine supply increases. It strengthens our proven network of providers that will administer these vaccines and cements and clarifies the path forward for those community vaccination sites. So again, what we're doing is providing more doses this week to vaccinate our over 65 population. We allocated 35,000 doses of COVID vaccine to the combination of healthcare provider sites and community vaccination sites around the state for this week. And really increasingly moving the vaccine out into communities to meet seniors where they are. So many of these doses, the majority of these doses are going out to more than 100 local clinics, hospitals, and other healthcare providers in communities around Minnesota. And to be clear, not every provider in Minnesota has vaccine yet. Those clinics and hospitals that are receiving allocations this week are the ones that we are highlighting on the map that was released this morning. And we are continuing to vaccinate seniors at a similar level to what we've been doing in the last couple of weeks at the 9 pilot sites. We'll continue to vaccinate about the same number of folks in the coming week, but in a different model. And we are connecting Minnesota seniors to information that will help them see where in their geographic area there are providers who have vaccine, although again, stressing again, the limited supply of vaccine available in any one location. The new online vaccine locator map is intended to make it easier for folks to know where vaccine is going around Minnesota so they can see how this vaccine ecosystem that we keep talking about, what that looks like geographically, and that map will continue to expand and fill in as more vaccine becomes available. And this mn.gov/vaccine website is where you will find that vaccine locator, which will, we hope, become a more and more useful tool in the coming weeks as more vaccine is available and more providers are able to receive and distribute vaccine. As the federal government gives us more doses, more providers will come online and more Minnesotans will be able to access vaccine closer to home. It's just very, very important that we be ready with having this whole system be prepared to not only administer every dose we have now as quickly as we can, but to be ready as that supply builds up. So finally, just another clarifying comment on the path forward for community vaccination clinics. So we had 2 very successful weeks of a pilot to test the concept of how do you stand up a clinic? What are all the logistics involved? What works, what doesn't? And we learned a lot. And now it's time to kind of apply those lessons to the strategy that we intend to use going forward. So this week we'll start up larger permanent or semi-permanent at least state-run community vaccination clinics in Duluth and Minneapolis. A 3rd site in southern Minnesota is in the works. We hope to launch next week. And additional sites are likely in the future as vaccine supply from the federal government increases. So we have to be ready to vaccinate Minnesotans in a large-scale, efficient, rapid way when we start to get more vaccine from the federal government. So the combination of our proven, reliable network of providers all across the state, supplemented by these community sites, will help us to be ready and help us to crush COVID-19 and get Minnesotans vaccinated quickly and safely as that supply builds. So with that, I'm going to turn it over to Chris Erisman for a few more comments on the vaccine distribution situation, and then we'll be ready for your questions. Chris.
Thank you, Commissioner. I wanted to provide a few more details on our vaccine allocation and distribution for this week. But before I begin, I want to just reiterate something that the Commissioner mentioned. We simply do not have enough vaccine for everyone who wants it at this time. Keep in mind that when we added seniors 65 years of age and older, we added 918,000 people in that age group. And educators in childcare includes about 250,000 people. So we added over 1.1 million people to our group to be vaccinated, even as we were finishing up phase 1A. So there is just to be clear, there is just not enough vaccine for everyone in those groups to be vaccinated all at once or all at the same time. Having said that, I'd like to tell you a little bit more about how our vaccine this week is being allocated, and there is some good news. Our normal weekly allocation from the federal government has been about 60,000, 65,000 doses. But from announcements last week, we're getting a 16% increase this week from the federal government. So that's just under 11,000 additional doses that we hadn't been getting in the weeks past. Along with that increase, we're also able to distribute 18,600 doses from the Federal Pharmacy Partnership Program to local providers. These are doses that large chain pharmacies were holding for future use and are not immediately needed this week. We gave them to providers that would be able to use the doses in 72 hours, including hospitals, clinics, the mass vaccination sites, and other providers who are vaccinating Minnesotans, like pharmacies. Of course, all for eligible populations that we're focusing on. We will be providing these PPP pharmacy partners with the doses that they need in a just-in-time manner when they are ready to provide them in long-term care in the weeks ahead. So they will get those doses back from our allocation, but we are using the doses that they didn't need this week to get them into arms. In total, we have about 98,000 doses being distributed across Minnesota this week, the most we've ever had. And here's where they're going. There are still people in phase 1A, the third priority group, that need to get vaccinated. So just over 50% of this week's vaccine is going to locations who will vaccinate people in phase 1A. This includes local public health, vaccinating healthcare workers, as well as congregate living settings like group homes. And as mentioned in our news release, we've got about 35,000 doses, or 35% of our allocation, going to providers to keep vaccinating people age 65 and older. These doses are becoming available because we are completing vaccination for phase 1A. So as we have fewer and fewer people in that group to vaccinate, we will have more doses available for our seniors. The doses are going to health systems, large, mid-size, and small, so local pharmacies, to federally qualified health centers, to the 2 new semi-permanent vaccination sites you've heard about, as well as other providers. We want to make sure that they are available to seniors through their trusted healthcare providers. And then, as we've talked about the importance of getting our kids back into school, 11% of doses are going to vaccinate those in childcare and education. We're getting available vaccine out to as many partners as we can. And as the commissioner said, this will continue to build our network for people who want to get vaccinated. But please remember that doses are still limited, even with this good news. So we don't have enough vaccine for everyone who wants to be vaccinated right now. But we know that vaccine will continue to come, and there will be more and more options for people to be vaccinated. So we ask you for your patience, and we ask that you recognize that we have a large task in vaccinating 1.1 million people in these groups, and very little vaccine to do that.
Your first question comes from the line of Greta Call from Green Post. Your line is open.
Hi there. My question is about Wisconsin. Throughout the pandemic, it seems that Wisconsin has sort of been on a similar trajectory, obviously diverging a little bit, but the number of deaths are pretty close, similar size populations. And I know earlier Chris had talked about how it wasn't quite clear why that was, given that some of the restrictions that Minnesota has statewide are not statewide in Wisconsin and that kind of thing. It's sort of this perception in Minnesota that Wisconsin has more lax restrictions. I'm wondering if we know any more about that now, that we've had a couple more months of data, or if you've talked to the people in Wisconsin.
Chris, you want to take that? Yeah, Greta, I don't have any
more information. We know that our neighboring states are also seeing reductions in case counts and deaths, just like we are. We have noted that our trajectory in terms of slowing down has been faster than those neighboring states, but I don't have a good answer for you in terms of comparing us to Wisconsin. I'm afraid at this point, the last few days, all I've been thinking about is vaccine. So thank you.
That's totally fair. And sort of on the vaccine note, I know there's been some discussion about when to announce 1B and whether that should wait until the federal government kind of sends more signals, or whether it might be better to try to announce that sooner. Any news on that, or when we might expect that?
This is Jan. I'll take that, and then Chris, you can certainly add in. As we've talked about before, we have a very thoughtful vaccine and allocation advisory work group in Minnesota that has done some thinking with us and has some suggestions about how, through those principles of how do we vaccinate for impact, how do we vaccinate equitably, how do we get the most health protection as soon as we can, how might we think about those next groups. The challenge, as Chris has said, is with the limited vaccine supply, it will be a while before we're getting into additional groups. However, we definitely appreciate people's desire to have a better sense of what is the path forward. So we are talking about that literally, as we speak in these next couple of days here, about what is the most helpful picture we can paint for Minnesotans about how this is likely to unfold over the next couple of months. So I don't have a precise date to give you about when we'll be talking about that, but I think the intent is to kind of talk more about what is further down the road in terms of the next waves of vaccination. Even as Chris has mentioned a couple times, we've got a pretty big population we're working through right now.
And Commissioner, if I could just add to that, Greta, please keep in mind that although there has not been a formal announcement of phase 1B prioritization, two of the groups that we're working with right now, which is our 65 plus and our child care and schools, they are included in phase 1B. So while we haven't made a formal announcement, we are moving forward, obviously beyond just 1A vaccination.
Thank you.
Thank you. And your next question comes from the line of Nora Hertel from the St. Cloud Times. Your line is open.
Hi, thank you so much. I know that the community clinic program was a pilot program. So am I right that other than administering the second doses, those will be closing? Is that correct?
This is Commissioner Malcolm, and then I'll ask Ann O'Connor to comment further. But I think it's important to know that those same sites will deliver the second doses. What I think we've said is that we're not sure how many additional community sites might be added in the future, and that's highly dependent on what is going to be the eventual ramp up of the federal supply and how much will we have available at any one time. So we don't want to say that the sites that we're announcing today will be the only ones operating. I think the intent is to continue to evaluate where community sites could help to augment the delivery system that's in place. But Ann, would you add anything to that?
Commissioner, I think you did a great job answering that question. And just to be clear, everyone who made their first vaccine appointment already has their second vaccine appointment for those 9 sites. And so starting next week, the second dose will be administered at the 9 sites. Pfizer vaccine is a 21-day turnaround. And so we'll be there starting next week and the week after. Thanks for the question.
Okay. And for the folks who are accessing the new portal to find places where the vaccine will be available, are you recommending that they reach out to healthcare providers listed on there? I wonder if there might be a bit of a rush or overwhelming of some of those providers if they don't have a lot of vaccine now.
It's a great question, Nora. I think we continue to ask folks to, to be patient with that and to recognize the reality that the number of doses any one provider has is not likely to be real large. We've suggested in the past, and I think it's still a good practice for folks to know that their clinics will have every intention of beginning to reach out to their patient populations when the clinics have vaccine. So for most of us, it makes sense to wait to hear from our clinics, but we certainly understand that people are eager to know when and whether vaccine is going to be more available in their communities. So that was the intent of the map, is to show where there is, where this week's, albeit limited supply has been distributed, so folks can see that it isn't just in the state-run sites, but that the vaccine is becoming more widely available across the entire state. We're sure that folks will be reaching out to the providers in their geographic areas, but definitely we know that there are a lot of folks who are eager for this information, and please be patient with your local providers.
Okay, thank you.
Thank you. And your next question comes from the line of Dave Orick from Pioneer Press. Your line is open.
Hi, I was wondering if we could talk a little bit about the number of people who will die shortly after receiving the vaccine from causes unrelated to the vaccine. For example, if I just did some back of the napkin math, if you use 2018 death rate for the 65 and older population, the 35,000 of which you're intending to vaccinate shortly, 109 would die within a month. Now that number is probably going to be less because some of those people are on hospice and wouldn't accept the vaccine, but it's a significant number. And we've already seen stories cropping up around the country of people jumping to the conclusion that the vaccine killed someone. And I haven't heard much messaging from you guys on that.
Great question, Dave. Chris, could you comment on that? I think it's an insightful question just about the timing.
Yep, and just to be clear for everyone, there was a great deal of safety evaluations that happened with these vaccines before the FDA approved them. But just like all vaccines that are approved in the United States, there is what is referred to as post-licensure safety evaluation. And so that is ongoing for all these vaccines. And there are a number of different systems that are used. And healthcare providers are expected to report, untoward events to these systems. One of them that I think people may have heard about is VAERS. It's the Vaccine Adverse Event Reporting System. And so that is a system in which providers, funnel all the information that they have. So for instance, someone who received the vaccine and then did happen to pass away, 3 days later, that would be the kind of information that would be included in VAERS, but it gets evaluated. And so the folks in that vaccine safety evaluation program would, look at the information and would say, what, this was clearly not related to vaccination. This is clearly not, an anaphylactic or emergent reaction to the vaccine. I mean, they would do the evaluation. So yes, we recognize that there's oftentimes, a relationship in time to things. So someone gets vaccinated and then, like you mentioned, that this is an age group where we know that there will be a certain number of deaths that occur, but the sheer association in time or temporal association between events does not equate to causation. So I want to acknowledge that there are robust systems in place that are set up for not just for the COVID vaccine, but for all vaccines that are constantly being evaluated. And yes, if there was a situation in which what we refer to as a signal was detected and there was some problem, there would be instant notification around the country about that, and there would be recommendations to stop or modify vaccination. We have not heard anything like that. And those, like I said, those situations are evaluated. And most often, are related or are unrelated, I should say, to anything to do with vaccination. So I hope that helps.
It does. I just, I mean, do you guys have any sort of a public campaign on this, or are you planning on it? Are you going to announce the numbers of people that would be expected to die so the public can be ready for it? That sort of thing.
We certainly have done public messaging about vaccine safety and how that vaccine safety system continues to work even after a vaccine has been approved. I guess we hadn't specifically thought to say that we would expect a certain number of people to die anyway post-vaccination. So we'll certainly bring this to our communications folks, but I think for the public, the important message is that there were safety evaluations that took place before the vaccine was approved, and those safety evaluations continue even after approval, so that we can make sure that we have the safest and most effective vaccines available.
Okay, thanks.
Thank you. And your next question comes from the line of Goin Howard from Star Tribune. Your line is open.
Thank you. As of last week, the systems that were vaccinating elderly had different age cutoffs. Some 80 plus, some 75 plus, some 65 plus. As a result of accepting vaccines, will these systems need to adhere to what the state was doing, which was 65 plus?
Glenn, you're a little garbled there, but I think we got the gist. This is Jan. I think just because of the very limited vaccine availability and the still in place principle of trying to vaccinate for impact, we are aware, and we've actually certainly encouraged health systems to be thinking about how best to deploy the doses that they have, and many are being very proactive, and I think appropriately so, trying to identify patients at the highest risk first, even within that general eligibility group. So we are aware that some systems are starting with higher ages first and working down, and we think that's appropriate, just given the reality of the limited supply.
Thank you. And on the existing waiting list, what guidance do you have for people who are on it? And people who are not on it, will they have an opportunity to get added?
I'm going to ask Ann O'Connor to respond to that. I think we've mentioned on prior calls that we see this list that's been created as a very valuable tool going forward. So I'll ask Ann to comment, and then perhaps Commissioner Tomes as well.
Thank you, Commissioner. We will be using the same pre-registration list that we did the prior week, and we will be running the same randomization process as we did last week with that pre-registration list for the upcoming week.
But Glenn, if I could just add, this is Chris Erisman. We want to remind people that list and those sites are not the only way for them to be vaccinated. And this rollout of providing more and more vaccine to healthcare systems, pharmacies, clinics, places that people normally get their medical care, that will be a really important way for people to be vaccinated.
Right, but can people get added to the list in the future?
Hi, this is Turk Tomes. Commissioner Malcolm, if you don't mind, I could jump in on that.
Yes, please.
We absolutely have seen how beneficial the list, having a list of people that are intensely interested is, and how it allows for broadened communications, not just with the community vaccination settings, but also connecting them with local providers that are administering the vaccine, and absolutely expect an opportunity to open the wait list up again for people to continue to express their interest.
And your next question comes from the line of Mohammed Ibrahim from Associated Press. Your line is open.
Hi, thanks for taking my question. I just wanted to follow up on that last question about the individuals who are on that registry who can't make it to those Minneapolis and Duluth sites. Should they wait until a site opens up closer to the area, or go ahead and use that new locator map to secure a dose that way?
This is Commissioner Malcolm, and I invite others to chime in here too. But I guess my reaction to that would be we're trying to be more clear with folks about all the various avenues that are now and will increasingly become available to get vaccine rather than waiting for a community site. As I mentioned, we don't have any definitive plans about where additional community sites might go up in the future. That's just going to be one of those things that we evaluate and now feel good about kind of having a playbook of how to do that and do it quickly when and if we get to the point where we've got a lot of vaccine in a short period of time to be able to get out. But in the meantime, yes, we would urge folks for whom these new semi-permanent sites that will open this week, for folks for whom that is not convenient, we would urge them to take a look at that vaccine locator map and see where in their areas there are providers with vaccine.
Thank you.
Thank you. And your next question comes from the line of Tom Hosser from KSTP-TV. Your line is open.
Hi, hello everyone. Commissioner, I was wondering, it's been about 3 weeks since bars and restaurants and health clubs were allowed to reopen for indoors. We haven't heard a lot about contact tracing lately. Have you been focusing on those places to see whether there has been an uptick in cases or whether it has not been a problem? And then also along those same lines, youth sports, have you seen many cases as a result of youth sports? And is there any benchmark or milepost you're going to use to maybe drop the face mask requirement during play for basketball and hockey?
Tom, I'm going to ask Chris to comment on what we're seeing in the data. I just general comment first that we're certainly, as I've said, pleased that we've got stability pretty much in our case numbers, although, as I keep saying, with still a fairly high level of case activity. And we know there's a lot of virus out there still. So just again, we think that the fact that cases have not, at least not yet, gone back up is a tribute to the fact that Minnesotans and these establishments are paying, good attention to the mitigation guidelines and avoiding, a lot of crowding and prolonged close contacts. So we think that that's what it's going to take to be able to keep having opportunities open for these various activities is just continued adherence to the guidelines that help to make those things more safe. But Chris, you want to comment on any trends you're seeing in the numbers and in the case investigations?
And on the youth sports as well.
Yep. We are now that we are a few weeks out, we are starting to see an increase in outbreaks associated with those settings. And when we look back, some of the onset dates were as early as the first reopening in January now, or I guess January was yesterday, but looking back to January, many of the outbreaks that we've identified are the second outbreaks for certain facilities. But yes, we are starting to see outbreaks. I think, as you know, it does take a little while for those to be identified. And the same is true with youth sports. I do think it's important you mentioned hockey and basketball in particular. Hockey is one of the sports that has had the most documented data about transmission associated with it. And so that is information that is always something that we are thinking about as we make recommendations. So we're continuing to monitor for those things, but we have started to see cases associated with bars and restaurants.
And is there any benchmark that you're going to use in terms of maintaining that face mask requirement that I know you have gotten a lot of complaints about over the past several weeks?
You mean a benchmark in terms of a number of cases or something? I think.
Yeah,
I think
if you don't see many cases, would you consider not requiring that while they're playing?
I think that the perspective is that is intended to reduce the opportunity for transmission. And so that is, something that we're anticipating will be necessary in order to keep moving forward with the youth sports that everyone is excited about.
Yeah, just one quick follow-up on the sports-related issue. Major League Baseball is trying to figure out when they're going to start their season. Have the Minnesota Twins and Major League Baseball been working with the Department of Health on when maybe the Twins could open safely? And I know they're working on a plan to present to you. Have you been having conversations with Major League Baseball?
I think this is Commissioner Malcolm. There are a number of conversations going both within MDH and others within the administration. We are certainly aware that everybody wants to do some looking forward planning. So those conversations aren't only with MDH, but certainly we are consulted and a part of those too.
Commissioner, can I just add one thing? I realize that even as we're talking about the reduction in the number of actual cases that we're seeing, which is very positive, I think we want to make sure that we're keeping the backdrop that we have had a number of variants of concern, so COVID variants of concern that have been identified in Minnesota, which suggests that these variants are circulating. And there's still a lot of information that we don't have about these variants, and the sheer fact that they could impact how effective the vaccine is and many other things means that although our case numbers are down, that doesn't mean that we're feeling comfortable, like everything's great and we can open up. There are a number of factors on the public health side that need to be considered, and that circulation of variants is really important because the more transmission we see, the more opportunity the virus has to mutate, and those mutations can have an impact on the effectiveness of the many tools that we now have in place, treatments as well as vaccine. So I just want to make sure that, whenever we're talking about these things, that we don't lose sight of the fact that we have identified these variants of concern circulating in Minnesota.
And so the variant could have an impact on the opening of baseball and allowing crowds back there in particular. Is that what you're saying?
Well, yes. I mean, just in general about how we think about things, we have to keep that in mind. I don't want to speak specifically to baseball because I have family members that would be so very disappointed. But I just want to acknowledge that even as we're thinking about any of these things we love, we have to keep in mind that we do have these variants, and that's a consideration that has to be taken into account.
All right, thank you all.
Operator, we have time for one more question.
Okay, your final question comes from the line of Matt Sepik from Minnesota Public Radio. Your line is open.
Hi there. I just want to confirm, and largely for the benefit of people who are tuning in on the air and on Facebook, the pilot program tomorrow is Tuesday, and I just want to confirm that there will not be a reopening of the website to add people to the wait list lottery. Is that correct for tomorrow?
That the selection process is going to run, and that the wait list will not open next week. I was going to actually kick it over to him.
Yeah, we won't be opening up the availability to get on the wait list again for this week, but we will be utilizing the wait list to randomly select individuals for this week's vaccine clinics. I hope that answered your question.
Yes, that does answer my question. And when will that random selection take place?
I believe we're planning on doing the random selection sometime tomorrow, and we'll be sending out communications to individuals either late in the day on Tuesday or early Wednesday.
And just final follow-up on that, given the increased allocations that Chris and Commissioner Malcolm mentioned, how many people will be selected in this particular round?
That's a great question. The community sites were allocated 6,000 doses for 65 plus populations in Minnesota.
Okay, so it's the same as last week then, right?
Fairly similar, yes.
You've been listening to state health leaders with the latest on COVID-19.